My name is Justin Lightburn, and I'm an interventional radiologist here at Goshen Hospital. Hemorrhoids are dilations of the veins in the rectum and anus. Hemorrhoids are a chronic problem for most people that suffer from them. They usually result in significant bleeding. Often they may result in pain. The standard treatments are initially dietary. If those treatments fail, then the patient will often see a surgeon for a hemorrhoidectomy. But interventional radiology has pioneered a new treatment that embolizes the vessels that would lead to the dilation of the hemorrhoids and therefore stop bleeding and often treat the patient's pain. The procedure is called a superior rectal artery embolization. So the patient will come into day surgery, we'll take them to the interventional radiology suite, the patient will receive moderate sedation, we'll access either the radial artery or the common femoral artery, and then we'll inject contrast to see where the vessels are coming from in the aorta. We'll select the superior hemorrhoidal artery and then embolize that vessel with a number of coils. Once the embolization is performed, the patient will be discharged the same day, usually after a period of 2 to 6 hours of bed rest, and then they can expect the cessation of symptoms probably within 1 to 2 weeks. So most often the bleeding, which is usually the most common symptom, is stopped after the embolization. Pain, which is probably the second most common cause of the problems, is often taken care of as well. So right now we've limited it to just patients who are not interested in a surgical hemorrhoidectomy. So almost all are, but right now hemorrhoidectomy seems to be the primary treatment. We usually allow the patient to see, or ask the patient to see a general surgeon, and from there they'd be referred to us. This is not in any way to replace a surgical procedure, but an adjunct to, so that we can help patients that are not even surgical candidates at all also get symptom relief. If the patient is interested in a hemorrhoid artery embolization, then you would refer them to the interventional radiologist via the Goshen Heart and Vascular Center. Then we'd see the patient in consultation and determine if they're an appropriate candidate for the procedure.